As you know, this will be a 3-month class. It will be connecting many subjects from various issues, diagnosis, prognosis, what is our line of treatment, what is medical view. Generally, when we treat a patient, the problem with us is that we get a patient, see, acute can be treated, chronic cannot be treated. This is what we know. Any patient who is in acute stage can be treated, but too much acute leads to death, and too much chronic leads to death. In between life and death, we have various systems of recovery. But one of the best system of recovery I found was this one, because I treated most of the cases which were rejected by senior physicians, senior doctors, and nothing could be done. So there was issues with all these patients. Not one issue or two issues. They came to me like this. And then to revive from that stage to this stage, grade 4 autism. I think many of the students who came to my seminar, they have seen the son of IGP, how aggressive he was. Now today you see, his autism has come to grade 2. Many paralysis patients have recovered to a great extent. CP children have recovered. From grade 4, focal seizures were 12, 28 times. Now has come to 3, 4. That is the power. We must understand that power of the dry needle. It is not discovered today. Only the view we must understand, what view we have to take and how we have to go. All the diseases, surgical diseases cannot be recovered. But after surgery, post-recovery, in most of the cases it is required. In gastroenterology, it is required. It is required in a high number of diseases. So, whatever doubts you have, you may ask me. It's an interactive session. You can ask the questions. Recordings of the classes will be available. So don't worry about it. You may ask the questions. Ask your questions, please. There are so many questions there. Now you ask your questions. You ask me so many things in WhatsApp group. Now you ask openly whatever you want to ask.
Good evening, sir.
Yes, ask.
Yes, Suvarna Balte from Raichur, sir.
Yes.
Sir, in the diploma course, do we have any written test or something, sir?
No.
Okay, it's just for knowledge.
It's an online CEP course we call it.
Okay, sir, thank you.
It is to upgrade your knowledge and increase a CV. That yes, you know this.
Okay, sir. Thank you, sir.
More questions? Ask your questions, please. Ask your questions. Now you have no questions. No, you cannot get like this. If I insert once in a week, you are treating a patient. You can nothing can be done like this. Patients' lives are precious. You will be like it will be a quackery. No, you cannot insert once in a week and you can get results. That means if you give medicines once in a week, you will get results. It is a vaccination or what? It is not a vaccination, Dr. Hassid. Ask questions. Yes. Ask questions.
Sir, this is Shanti from Tamil Nadu.
Shanti, tell me.
So, how can we diagnose the patient for accurately if the patient have a headache means so there is more reason, right? So how can we identify this patient has this kind of headache?
See, for understanding an headache, you must know various classification of headache and the indications of headache. So first thing, when the patient is having headache, you must know which pathway and which area of the brain is having headache. Number one. Number two, then according to those indications, first of all, we go for CT scan or MRI to find out is there any internal pathology, tumor or anything else. Third, if nothing else is there, then you have to find out is it cluster headache or any headache, any type of headache, stress headache, cervicogenic headache. Based on the symptoms are the guidelines for the disease. What kind of symptoms he has, that will only define what is his disease. If he is having sinusitis, it is because of sinus. Simple question. Symptoms will define the disease. You must be able to catch the symptoms.
Uh, yes, sir. And actually, in Tamil, based on the treatment, so they are getting the based on pulse. So can we
Madam,
treat
morning I
based
told
on
you
the
medical acupuncture, we don't diagnose the patient basis on pulse or tongue diagnosis. You are speaking about TCM. You are entering a medical acupuncture course and then you are planning to diagnose the patient on the basis of pulse. Can you diagnose a patient on the basis of pulse having brain tumor? Do you have
no,
that
we can't.
efficacy?
Yes.
Do you have the efficacy to diagnose the patient on the basis of brain TB,
No, sir. No.
metastasis, cluster headache?
No, sir.
And how will you explain the patient? Your kidney energy in is low, kidney in is high. All these things patient will ask you. Patient will understand all this.
No, sir.
Then where are you? Without knowing anything, without understanding anything, without concluding anything, just start something and get somewhere. Take your car and reach somewhere. Will it help you?
No, sir.
Then
But sometimes it will help. So,
Madam,
like
help can be taken from any direction. Help means something is not primary. What is primary is primary. Primary means you have to rule out what is the cause of the disease. Because
sure,
if you are not able to rule out the cause of the disease and you keep treating, you must know there is recently there was a court case in Punjab, Haryana High Court. A acupressurist was treating gangrene case and his anticipatory bail was rejected. Similarly, a case was found in Singapore. The patient was having sensory deficit. His leg had no sensation. He put up the TDP lamp. Because of the TDP lamp, his leg got burnt up. And then the case was filed. And then he had to file 1 million Singaporean dollar as fine, plus 5-year license was cancelled. In India, you will have to go to consumer court to fight your case. This is not alone with you. It is with all the allopathic doctors. The most of the victims are the allopathic doctors who are running from court pillar to post in their cases. Many orthopedic surgeons have gave up surgeries only because of court cases. So your
yes,
diagnosis,
sure, I understood.
prognosis, and explanation. These three things should be very correct, and that is called counseling. Counseling of the patient should be very correct at the onset of the treatment. What you understood, what he understood, and what the Google is saying, and what the previous documents are saying.
So can you hear me, sir?
Yes, Mr. Henry, please tell me.
Yes. मेरा नाम Henry Singapore से. Anyway, just now you're talking about sinusitis, sir. Can your brain mapping method treat this problem, sir?
The sinusitis can be treated in various ways. Surgery
Yes,
is one of the way. But if you don't want to go for surgery, this needling process also helps because I had sinusitis 30 years back, right?
yes.
And I used to use one nasal drop, right? But from
Yes.
last 15 years, hardly in seasonal way I use it. Otherwise, I'd never use it.
Uh-huh.
And it was recovered in the PIS pure only on the needling because we were fed up of everything. My father went 42 years after surgery, also he did not recover.
I am now treating a patient who has sinusitis or rhinitis for the past 7 years. And he has seen all types of doctors, allopathic and TCM. And the other day, for the first time, I tried brain mapping on him. He could feel that his breathing is easier. His four cavities are more clear, but he still do not have the sense of smell.
The sense of smell is done from brain. Your brain.
Mr. Jailu, can you wait for your turn? Switch off your mic, please.
डेली ग्लास मालिक फ्राइडे फिलोसफी क्लास
अरे मिस्टर अब्दुल जालिल, क्या बोलता है?
See, Mr. Henry, The question is that it is a stepwise process. Losing a smell means losing the definition of smell, and it is content in the brain. Everything what you assess is for the help of the brain. It is intertemporal, right? So something has gone wrong in the brain by which the assessment of the smell has gone. So there is
Yes, sir.
transmitting and receiving. One
Mhm.
has to transmit, one has to receive. Both has to be perfect. If there is any deviation between both of them, you will not get the smell. Basically, in sinusitis, you lose the smell in chronic cases. Yeah.
Yes.
But gradually you overcome with the treatment. Yes. Body has the capacity to revive and recover. We have seen many cases which has been revived and recovered. If you go to my Facebook, there are lakhs of videos by which you can prove the efficacy that yes, dry needles really work.
Yes, that's very encouraging because I tried the brain mapping method, so he could straight away breathe properly after 15 minutes of the treatment.
Oh, that's very nice, Mr.
Yes.
Henry.
So I'm so happy to report to you on this achievement. So I was thinking, if we could bring back his sense of smell, that would be even more marvelous, isn't it, sir?
See, continuous work and continuous affordability. Neuroplasticity speaks that whenever there is loss of anything, continuous stimulation, continuous walking on the patient, right,
Yes, sir.
will revive. But it should be in a logical way, in a time specific way. Because if you give him something like that and you are not able to succeed, patient may spoil your name. So you must plan out the case and see whether you are going step by step to a different cases. You must always check different colors, right?
Yes, sir.
Smells, right? He may not be able to understand one smell, but there may be various type of smells which he may able to take.
Yes.
So
So
smell
his sense
testing is
of
another
smell,
experiment which you have to make on the patient,
yes. We
which
started
we as
with
physician,
yeah, we started with perfume. So actually, after the
no,
first mapping
it should not be
simulation,
one
brain
smell.
mapping,
It should not be one
yes,
smell. It should not be one smell. It should be
different
around,
scent, yeah,
yeah, different smells.
yes. So we started with a perfume, and then we brought one very famous fruit in tropical countries, the durian. For him to smell, he couldn't smell anything.
You
So
will find more critical cases here. Smelling
yes,
is a very different issue.
yes. But I'm very encouraged, by the application of brain mapping, which we have learned during our last class, and it really works. So I'm so happy to report to you on this.
I'm really obliged that you have been confident being staying in Singapore and going with the best medical systems. You applied this dry needle based system because you have beyond TCM board. You went out of the van, you did it, and you achieved your results. It's really encouraging and
Mhm.
gratefulness as to invest in this matter.
Yes, thank you, sir. Look forward to your coming class.
Oh, thank you so much, Mr. Henry. We are really grateful to you.
Thank you.
Maybe get more.
Pradam sir, Mukesh Rawat.
Yes, Mukesh ji, please.
So for continuous treatment for neuroplasticity, how many days maximum we can take that?
See, you cannot estimate this.
No,
See,
not about treatment, sir. I'm talking about after how many days we have to call the patient.
no, you cannot estimate this. You have to routinize your routine and the patient routine.
We can
Both
call him 3 days, 4 days.
you can estimate your time.
Okay.
See, neuroplasticity is different thing. Question is the revival of the patients and the symptoms. The terminology is neuroplasticity. It is used in every phase of life. Even you use it in driving, even if you use it in car driving, use it in any phase of life.
So if we call patient sickness, then it will be possible if symptom is reducing.
See, symptom is reducing, but does not mean that until you reduce the end result, you should be very careful because there may be deformities in the last part of the disease.
Okay, sir.
So the cook-up splint, all these things has to be included in the treatment.
Okay, sir. Thank you, sir.
Based on one basis, no results can be achieved.
Okay, sir.
And during this time, you may achieve UTI infections, you may achieve lot of comorbidities, right? Bedridden
Yes.
patients have lot of problems. So that those things has to be very clearly addressed.
Yes, sir. Thank you, sir.
More questions? More questions, please. You have a lot of questions. Why don't you ask? What
Excuse
is
me,
it?
sir. So in the coming course, do we have any practical sessions, sir?
Practical sessions can be seen through the Facebook videos. How will I
Okay.
put Facebook videos like this?
Yes.
Is it possible?
No, sir. If any emergency cases, can you show the videos, miss, live?
And we may go through the mobile. Yes.
Yes, sir.
Sastri ji,
Yes, Vali.
would we be able to do practicals like we did before, where we have patients in our clinics and you assist with the treatment based on what you have seen and the investigations we have given, and you guide? So you're supervising
It
like
depends
if
on the
you were in
quality
class.
of the person who will be with. We cannot go with the random person.
Okay, sir.
If the quality of the physician is good and he is capable of doing this, we have no problem in giving any instructions.
Okay, sir. Thank you very much.
Because if he
Okay,
does
sir.
not understand anything, and tomorrow he will come up with another complaint.
Yes, I understand, sir. That will serve very much for those who you seem fit and qualified to be a form of practicals for them, because they would now be hands-on with your guidance. It will just be the
We
same.
definitely encourage all these things. Everything has to be encouraged. Whichever increases your confidence should be encouraged.
Thank you very much,
I
sir.
saw one person who came with Mukesh Rawat. He's just a Ayurvedic doctor, but he revived a patient from comatose stage. Not one or two, many. I thought he is the most Mudit Tomar. I thought he is the most gone student of my class. But then I saw, oh, he is really another genius. After talking to him, speaking to him, you cannot read a book by a cover. Sometimes we also make a mistake. I was ignoring him in initial stage, but then later on I came to know he has a deep knowledge.
MashaAllah. That's good, Sastriji. Thank you very much, sir.
So let us not ignore anyone. But the question is that we must know what we are doing. What is our limitation? A surgeon also knows his limitation. So we also must know what is our limitation. Crossing our limitation is only a mistake what we do. Why should we cross our limitation? Knowing my points and putting point, no one will recover. I spent my entire career. But going by a proper way, patient will recover. Ask questions. See, it is an interactive thing. You must ask whatever you want to ask. About certification, about this, you ask. Later on, if you ask, I cannot answer.
Sir, brain tumors like glioma and cervical
Oh,
marosis tumors are curable.
brain tumors has to be removed by surgical procedures. There is no procedure by which it is written, and it is clearly mentioned in a Punjab Chandigarh High Court judgment that anything which does not come into your preview, you are legally liable for that.
Thank you.
If you do tumor treatment, you may do with the what? But if it becomes a police case, you have to go to the court. And you have to not only go to the legal court, you have to go to the consumer court also. That is why you must know what kind of headache it is. That is why you must know various things about the disease. That is what you must know how much you can do, what kind of counseling you must do, what is the method of treatment. All you should know. Ask questions. Whatever is your doubt, you ask.
Sir, his classes will start on 5th August.
Will take more time. Let there be a more counseling because many people have a lot of doubts. So first, every doubt has to be cleared.
Okay. Sir.
You don't see in WhatsApp group so much things they write. Now why don't they ask? Writing is very easy. Ask, what are your doubts? You ask.
Good evening, sir. It's Mika from Indonesia.
Amit, tell me.
I want to know whether an acupuncturist is kind of medical professional because if it is not regarded as a medical professional, then I'm not eligible to join your program. Thank you so much.
See, not like that. See, one thing I tell you. Question is it is a CEP program. Why we call it medical? Because you come to across with MRIs, where you go through various scales, understanding. It will upgrade your knowledge. I don't understand what is the question of not having knowledge. If you are doing something wrong, you yourself will do, you know what is wrong. Do you know what is right and wrong? By learning something, how it can be wrong? Mika,
Yes, sir.
removing
I'm in the hospital. I'll call you later on. Thank you so much. It's an emergency case.
1 minute, removing your ignorance, removing your darkness from your mind. What is the harm? It will improve your efficacy, understanding, and depth, and limitations. Whether it is very good that you must know what is your limitation. Others tomorrow will take a brain tumor case, like this person has taken a acupressure case in gangrene and straight away went to jail. You must know your limitations. Classifications.
Excuse me, sir. This is Subramanian from Chennai.
Yes,
What is the prerequisite knowledge required to join this program, sir?
See, actually, prerequisite, generally these programs are called CEP programs, Continue Education Program. If these programs are launched to increase the knowledge of the person. It is a state which defines the rules of practice. For example, can an acupuncturist be given a license to treat a brain tumor patient? Can you treat a hematoma of the brain? Can you do a brain surgery? No. If you don't have the knowledge of the subject, then how will you upgrade it? If you don't know, you have to continue to study. Many people do not know. Putting a degree on the wall will not recover a patient.
So, so the
You must have
students.
capacity.
So those who are joining also having doctor degree. So I have only diploma in acupuncture and I have a TCM background. So am I able to pick up the
I'm not
class?
saying what background you have. That is not the question. And did I ask your background right now? I am asking you only a simple question. What are your doubts? TCM is different. TCM is based on tongue and pulse diagnosis. Medical acupuncture is based on medical diagnosis. You are dealing with comatose patient, you are dealing with osteoarthritis grade 4, you are dealing with those cases which has been post-operated, you are dealing with those cases which is difficult cases. You imagine there is a person over here whose tibial nerve, whose brother's tibial nerve is 0.4. It is Rita Arsa. If you see NCV study of his leg is what? Tibial nerve is 0.4. That means the patient can go to a paralytic state any moment or foot drop any moment, right? But he took the timely treatment and by chance other nerve conduction improved and the way the patient is what? Normally walking. But hence there was a fourth disc collapse this patient would have not survived. This is the interactive class to make you
So-
understand two things: what you can do, what you should not do. So what you cannot do, better don't do. You know
Yes,
what you can do, right?
Yes, sir.
And what you know what you cannot do. So what
Yes.
you cannot do, you just refer upgrade. For example, I never entered the critical. We have a ICU doctor who's a former professor, HOD, MD medicine, orthopedic doctor, neurosurgeon. Do I enter their field?
Yes, sir.
Do I go enter their field? No. Even an allopathic doctor will not enter. What does he write? Refer to so and not so. Learn one language. It will only upgrade your field. If you deteriorate your case and then you refer, what will happen?
Sir, when you said the medical acupuncture, do you start from the basic, or we don't know whether you start with the
I'm not going
advanced?
to, no, I've already written about the diseases. I'm going to start from neuroanatomy and all. I'm not going to start from very basic because it is not going to be a medical college. I've specified what kind of diseases we can,
Yes, sir.
because this course is running from 3 years. Most of the students are old students. Rest of the things are in Google, Facebook. Just type the button and study if you don't
Yes, sir.
understand anything. My only thing is don't make false claim.
Yes, sir. Thank you, sir.
More questions? More questions, please.
Sir, sorry for that. I couldn't understand whether he can attend this class or not, or he's eligible or not, because he completed TCM.
Everyone is eligible to attend the class. So, because I don't give you a license to practice. License is given by whom?
But we can learn, right?
Who stops you from learning?
We can get a knowledge. That is, we can get extra knowledge, right?
Yes, who stops you from getting knowledge?
Thank you, sir.
Did I say? Only the worriedness is that if you don't understand the disease and if you do something, you will be in trouble. But that does not mean that you cannot do anything. You can do many things. It's just a matter of time. Once upon a time, I thought I cannot do anything for autism. But today, if you see, half of my hospital is full of autistic child. I'm an autistic physician. I was only known for sleep disc and paralysis. Am I able treating all difficult diseases, dystonia, dystonia, all difficult dystonia? So we gain experience. We come across complications. And that experience is what you have to learn. Otherwise, keep reading books, you will find nothing. Answer, if you read Google, you will find one answer. Put Botox. After putting 10 Botox, also no results. What you will do?
एक्सक्लूसिव हमारे विले के ऊपर ही है बस।
हो गया
This is classes for video.
अभी बारिश होगी।
More questions, please. More questions. Ask questions, please. There's so many questions in WhatsApp. Now ask us.
चलो तो बोलिए चलते हैं बाहर के।
Hello, somebody from Dubai, please mute your mic.
Excuse me, sir. Excuse me, sir.
Tell me.
Sir, I'm Shilpa Kicha from India, Chennai. Sir, I just want to know basically what you're going to teach us in this upcoming course, sir.
I have written in the brochure, you did not read.
I read, sir. No, you're going to teach us the treatment way or procedure, how to select the point with dry needle.
No. You cannot think that selection of points are so easy. We may give you some protocols, right? But the condition and status of the patient cannot be determined. First is to know allopathic diagnosis of the patient.
Okay,
Grading
sir.
of the patient. Under what grade in Parkinson's 1, Parkinson's 2, Parkinson's 3, Parkinson's 4? Do you know this grading? Who are speaking to me?
Yes,
Hello?
sir. I'm listening to you, sir. Hello. Yes, sir.
Do you know this? They are reading which kind of patients?
That is what, sir. Sir, I just know a basic acupuncture treatment, sir. I don't know how to
What I am
diagnose
saying
the patient for.
the question is, what is basic acupuncture? What do you mean by basic? What kind of patients do you treat?
So like maybe heel pain, knee pain, body pain,
Now
or
tell me,
shoulder.
explain me 1 minute. Explain me 3 reasons of knee pain.
Sir, pardon, sir, I didn't get you, sir.
Explain me 3 reasons of knee pain.
Sir, knee pain can be due to spleen, stomach, and kidney issues, sir.
Who will understand this?
The patient will definitely not understand all these things, sir.
So there is no use today. What will you explain? If you don't know how to see an X-ray, how will you understand what is this stage and reading and all these things? Remember, it has been made as an independent medical science. If you are not upgraded and if you are not in upgraded mode, what will you treat?
That is what, sir. I just want to know what kind of course you are going to take, sir. I have actually
I've
no clue
already
about it.
explained you all that already this discussion has been continued that what is a disease, great classification of a disease. We have been treating the same things from last 3 years. You might have been missing classification of a disease and in each reading what are the things available, allopathic side and medical side, what is your role, what is the role of a physiotherapist, what kind of strengthening you have to do, some type of physiotherapy you have to learn. It's a continuous study. If you think just by picking needle the patient will recover, I don't find that it is possible. You are saying about shoulder pain. Can you classify how many types of shoulder pain are there? Shilpa,
Yes, sir. No, sir. It is quite difficult to classify, sir.
why you did not study it in YouTube?
Sir, what we have studied is depending on organs, sir. Like it can be a large intestine or
See, you are saying something which no one will understand you. You will not be even in a position to diagnose the disease. You must be well understood about the pathology of the disease. It is adhesive capsulitis, there is frozen shoulder, rotator cuff injury, clinical signs of the disease. All this you have to study. It is what Dr. Mahanirvane was saying. If you don't understand a disease and if you treat it and if something goes wrong, you will be in trouble. I tell you about the orthopedic surgeon. He treated a hip injury, a hip replacement. After 2 years, it went to what? Foot drop. There was a consumer court case under this doctor. And this doctor, after so much fighting, he gave up his surgery. He decided not to do surgery. And there are not one or two. Hundreds of cases are pending in the hospital. Recently, Apollo Hospital has paid 125 crore rupees to an patient. Question is, you must know what you are treating. Proper counseling of the patient is important. For proper counseling, medical diagnosis is most important, radiological and pathological. If the patient is suffering from infection and you keep treating the patient for fever, and he's suffering from UTI, as my brother did, what happened? My mother died with sepsis. He kept pushing on moksha. He did not realize that this urine infection may lead to sepsis. What will happen? So improving your knowledge at early level, I don't find it is wrong. Improvement is most important part of your knowledge. And everyone is improving. Every neurosurgeon, orthosurgeon, everyone. I found Dr. Nirvani is so excited that whenever he gets time, he flies directly from Mumbai to the Hyderabad for just 2 days to learn something extra from me. And he's happy with that. He's a senior orthopedic surgeon. So learning is your own what? Approach. Learning should not be stopped. Am I right or wrong?
Yes, sir, you're right, sir. Sir, but
Ask
what
more
will be your
questions.
method? Yeah, yes, sir. But what will be your method and procedure, sir, during the class?
Procedure is different.
Sir, your
Disease you
voice
are
is
treating.
breaking, sir. Sir,
The needles are there, locations are there, decisions are there, various methodologies are there. Do you think only TCM is a methodology of treatment? No, there are various methodologies by which you can treat a patient, and revival is there. The deeper you go, the more you enjoy. There is a person called Halalu. He is an electrical engineer, right?
okay,
Recently
sir.
I went to column. You understood? I
Yes,
went
sir.
to column for his care. I was his medical knowledge. I don't know Malayalam, but the way he was counseling the patient, in 1 or 2 years, his knowledge is up. He not only patient, he counsels.
So, pardon, sir, your voice is breaking.
Still breaking.
Yes, sir, your voice is breaking. I guess there's a
Still my
network
voice
issue.
is.
Yes, sir.
Medical acupuncture means you are not using tongue diagnosis and pulse diagnosis. You are using what? Osteoarthritis as the part of the disease to be treated in a what? Osteoarthritic way.
Okay, sir. Thank you
It has
so much,
nothing
sir.
to do. It is nothing to do with spleen. All these things does not come. This is a grading. This is how the treatment has to be followed. This is what we have to understand. These are the ways. These are the distal points which gives immediate relief. These are the methods. These are the strengthening methods. These are the things which we have to follow up. One more important thing which you must understand: cure and all these things should not be put up. That I can cure cancer or cancer has been cured, especially in India, because government of India has passed a law, Magical Remedies Act, in which the word cure cannot be used. for many diseases. That is why again and again I said, go and see my Facebook. You see lot of videos, which kind of patients have recovered, how they have recovered, what is their testimonial, what is their pain relief, how much pain relief comes, what is neurosurgery versus cervical radiography. Can a patient you speak, I don't speak. Can you revive a patient who is from paralysis? Can you revive a patient from CP, autism? I think many people, many of my students have done successfully and they have put up their studies, not only from Indonesia, Malaysia. They have given up their rights up in what? Facebook, that they have been able to recover the patient. Problem is what? In chronic cases, medicines do not recover. If there is any medicine for paralysis, can physiotherapy alone recover paralysis? We need the support of physiotherapy and other things. But can it be recovered? Can it be recovered by Ayurvedic medicines, Unani medicines? Can you create neuroplasticity because any size of the drug which is higher than 50 teltons cannot reach the brain? It is the proper signals which will reach the brain and what? Brain is on dynamicity. It will recover. Body has the capacity to revive and recover. When in the last stage of cancer, you can work as a palliative care specialist. Don't you see so many palliative care have been established? In my own sector, they are so difficult cases. Alzheimer's, Parkinson's. If you step in my center, you will become mad. Last stage ALS patient I am managing, motor neuron diseases. CP Childs is a son of a IGP. He was highly autistic. His mother committed suicide. Now that child has recovered up to how much? 60%. We took time, but he recovered now.
Sir,
We
so
must know
basically you do
we are
treatment only with dry needles or any other,
medical acupuncture
I
means
cannot hear you,
dry
sir.
needle.
Again your voice.
I
Okay,
think
sir.
something is problem. Can everyone hear me? Rawatji, can you hear me?
Yes, sir.
Yes, sir. I can hear you clearly.
There is a problem on your internet.
You're loud and clear, sir. He should check his system, his internet connection.
It is medical acupuncture does not means using medicine. Medical acupuncture means medical conditions of the patient. Because irritable bowel syndrome is not defined in acupuncture. You see, Cervical radiculopathy, myelopathy, myelomyalgia, not defined. You must be able to diagnose which stage you are treating and what you are treating.
Okay, sir. Thank you so much, sir.
No one is, if something goes wrong tomorrow, and then you will say, oh, what has happened? You will put every acupuncturist in India in trouble. Why? Because the rules are not framed. Stringent rules will be framed if your knowledge is not correct. You must know what you can do and what you cannot do. As an allopathy doctor, he also knows if you give a little extra dose, he has a sweating on his head. He has a license. But if he does something little like this, it is a sweating, his heart goes up and down. Yesterday, a patient was shifted from ambulance from Bangalore to Hyderabad for recovery. Her pulse rate went suddenly within half an hour, it went to 45. But then everyone was in hurry. I spoke. I saw the clinical signs. I don't rely too much on machine. I take their support. But then I immediately took the ECG. We saw some depression. And then we advised the physician who was there to give him atropine, half cc. And then after 20 minutes, half cc sublingually, where? Here. And then I gave some points. Patient is what? Stable. So such type of patients will not come to you. What kind of patients will come? Knee pain, cervical pain. But you must be able to understand various classification and stages. Some type of paralysis. So you must be able to understand what kind of paralysis it is. Temporal lobe paralysis, capsulogangular hemorrhage. Stenting has been done. But what damage is there, you must be able to understand. And then how to overcome these damages with the help of dry needles. That is the important aspect. Question is, what you do not know, you must know. And what you cannot do, you should not do. It is a golden line written in medical science. And if you want to learn, you should upgrade your knowledge. Am I clear?
Yes,
Yes,
sir.
Yes,
Very
sir.
clear, sir.
More questions? Ask questions.
Good evening, sir.
Yes.
So my name is Shivani and I'm from India. I'm working as a physiotherapist. As you have given example, like
Yes,
first
sir.
we have to diagnose the disease, what kind of symptoms or what kind of problems patient is having. Moreover, we are like, as a physiotherapist, we have already pre-prescribed prescriptions with us from doctors like orthopedics or neuros. Uh, they have prescribed medicines also. And for us, they have like what you have to do in physiotherapy. And after um, testing some test or performing some movements, we are able to get like what we have to do in this patient, what kind of machines we have to use, or what kind of exercise should we suggest. As you have given example like osteoarthritis, sometimes patient come with like grade 1 or grade 2. Mostly it's a irreversible type of damage in knee arthritis. Then after learning this neurostimulation or this medical are we able to treat it also? Like we are able to increase or
Did you go to my Facebook video?
yes,
You
sir.
have been to Facebook. What did you
Yes.
study in my Facebook video? Please tell me.
Videos where patient is having like very much pain. I think it's on 8 out of 10. And after the treatment, she's able to walk properly. Her walk is very much comfortable, as she described. But I would like to know that symptom is only resolved, or the reversible damage in the joints also, like what we have found
Okay,
in.
one thing I tell you. Once there is a damage,
Yes, sir.
there are other things which can support the damage. Why don't you
Yes,
see the supporting things?
yes, sir. Yes, sir.
Can your machine recover the patients?
No, sir. No, sir. Physiotherapy machine is only we can sedate the pain, we can relax, we can improve the circulation. That's all we can do.
Yes. This acupuncture needle go deep in the piriformis muscle and it revives the piriformis syndrome.
No, sir. No.
Yes, I have done.
Yes, sir.
I have evidence.
Yes, sir. I have seen your videos. That's why I'm asking.
I'm having more than 2 lakh videos. Go and see, check.
Okay,
From
okay.
videos in the OT room, what I have done, how I have done with CT scan, CT guided procedures. I have done my CM guided procedures. I have done.
Okay, sir.
Only dry needles.
Sir, one thing I would like to ask more, like you have working in a setup, you have very vast team of. If like me, I'm working individually in my clinic, what should I refer most, or what kind of test should I refer? Firstly, other than X-ray and some kind of blood reports, other than that, what should I refer before treating the patient, like in acupuncture?
RP and UTI infection.
Okay, sir. Thank you so much, sir.
UTI, urine culture, and CR, C-reactive protein. Complete blood profile, C-reactive protein, and urine culture. These 3 things has to be seen in a patient. In a chronic type of patient, if he is suffering from paralysis or any other thing. Because these people are prone to infection. Ask more question. It is, see, one thing I tell you, we have to find ways by which patient can sustain his life. I told you that orthopedic surgeon said, I have stopped surgery after doing 3,000 surgeries. I have choose this integrated method. Why? Because I found people get better relief without surgery in a laser course.
Hi, sir.
Yes.
Sir, in a CVA case,
First,
hemorrhagic CVA,
what is your
can we
name?
treat?
What is your
I
name?
am Mandian
Mandian,
from India.
what is your education background?
I am homeopath, sir.
Tell me.
Sir, in a CVA case, hemorrhagic CVA, the patient is having hemiplegia, and how can we treat the patient without antibiotics in
Which
medical?
area of the brain, which artery has been hemorrhagic? Which area is damaged? Where the keratotomy, keratoplasty was done?
So
All things.
they are directly connected.
See, one thing I tell you. Do you know neuroanatomy? Say honestly. Excuse me.
Not clearly. Yes, sir.
Say honestly, do you know anatomy? Neuroanatomy?
Somewhat I know, sir.
What do you know in
Basic knowledge, sir.
What do you know about it? Neuroanatomy. Please tell us honestly. No one knows you here. So don't worry, your picture is also black. So tell me, what do
Sir,
you know?
I just know the basic anatomy of brain. That's it, sir. I don't know neuroanatomy.
Then do you think by knowing the basic anatomy of the brain, you can recover the brain?
No, definitely.
Then what are we doing with paralysis patient?
Sir, but you have done with the medical acupuncture, you have recovered some cases. That's why I'm asking to you.
I'm asking because we create a pathway inside the brain. That's what I'm saying you. You have to learn many things.
Okay. So there is a chance without any drugs we can treat
There is
the
no drug in the market.
patient.
What drug you have after the Leofen? Which drug can recover paralysis? Please name the name of the drug.
There are no drugs for paralysis in any
Then,
system.
then how these patients recover? You say after 6 months they do not recover. How they recover after 18 years?
They can't recover, sir.
Who told you they can't recover? I have evidence. It is a social evidence examined by neurosurgeons and everyone. Eminent neurosurgeons are there in my Facebook. They recognize, they revive, they refer. You are saying allopathy doctors do not believe in acupuncture. I see Dr. Mohan Singh, who is a professor HOD critical care and anesthetist in Udupi Medical College. He is a medicine doctor, he is an orthopedic doctor. All they do, we do combinedly. There is no problem. I don't know where is a problem. Problem is in our knowledge. We are not able to encounter. They ask us some question, we are not able to answer it. They ask me questions, hundreds of questions they ask me before they get convinced. When Mudit was not convinced with me in the first tour, but now why is he convinced? To convince anyone, what you need is to upgrade your knowledge. Now there is so many ways to upgrade your knowledge. Just take out mobile and study. Different classification, different stages, different modes. But when you go for the treatment side, there is a very limited treatment. The diagnosis of the disease is this much. Treatment is very little. So this gives us an additional pathway by which we can recover the patient, we can save the kidney of the patient from pain, we can give a long-term recovery. In sports injury, we can revive the patients. We can revive the patient in a very difficult cases. We can give instant relief in seconds also in very critical cases by using different techniques. And it is not me alone. When I went to Philippines, I taught them, they are doing. Malaysians are doing. Indians are doing. Dr. Ravindra, can I talk to you? Oh, it's Dr. Ravindra.
Yes, sir.
You are Dr. Ravindra Mesharam.
हाँ सर.
आपने कोई दिल्ली से पेशेंट रेफर किया
हाँ
है?
सर. सर मैं पेशेंट एक पेशेंट रेफर किया था.
कोई पंजाबी
क्या
लेडी?
बोलते उसको? हाँ हाँ सर.
पंजाबी लेडी जिसको आपने बोला था 5 दिन में ठीक हो जाता है, ऐसा कोई रेफर
हाँ
किया?
सर. हाँ सर. हाँ.
हाँ वो आई है बाबू, 5 दिन में
अच्छा
नहीं
अच्छा.
ठीक होता है पेशेंट.
यस सर.
Patient needs time to recover. In any system of medicine, we have continued antibiotics for 25 days, 30 days, 40 days, 50 days, 60 days, many infections. Then patient revives. Yes, coming. So it's up to you what you want, you don't want. You don't want to upgrade your knowledge, don't upgrade. You remain behind. Instead of encouraging others, you know what is your problem? You are more on the negative side than on the positive side. The moment you become more on the positive side, you can recover large number of patients. I have recovered. I use only dry needles. I don't use allopathic medicine. Although I'm working in an allopathic center, I don't use it. And people come here not because of medicines. People come here only because of this treatment. They come from the best hospitals of Hyderabad. They come from the best hospitals of India for this treatment, not for medicines. But we include medicines because infection and all has to be overcome very soon. It has to work in an integrated manner. But so far, pain management, paralysis management, all these things are there. Irritable bowel syndrome, which cannot be cured, this has been revived to a great extent. Cervical dystonia, which patient has been suffering from last 3 years, has got some relief.
Excuse me, sir.
Yes.
Swarna Balchit, sir. Sir, with an acupuncturist, it's okay, they can practice. But after we gaining the knowledge and when we are confident of practicing in acupuncture, can we practice with this? Can the diploma certificate permit us to practice, sir?
It's all up to the state government what rules they have made. The rules are not made right now. It is only made in Mumbai. Government of India has not made any such rule. They have said that allopathic doctors, Ayurvedic doctors, homeopathic doctors, or appropriately trained person. You must be appropriately trained to work on the patient you are working.
Yes.
This is the law of 2003.
So can we seek any job in your institution with this diploma, sir?
We don't have vacancies here.
No, if sir, in future.
We
It's
don't.
just a question, sir.
See, if you ask me this type of vague question, I cannot answer because our patients are very serious. A newcomers cannot manage a patient.
Yes, sir.
Because patients comes to me from ICU, patient comes to me from where? Direct after surgery.
Yes, all serious patient comings.
Yes, they will not come to your clinic.
Yes, sir. Yes, sir.
Why don't you work on those cases which can be recovered?
Yes, sir. Yes, because our path is different, no. So that just I want to clear the doubt. That's all.
No, don't work with serious patients. You will be in trouble. Work with normal.
Yes,
There are so
sir.
many diseases. I don't understand why you
Yes,
want to
sir.
a patient.
Yes, sir. Any serious patient will refer you, sir. No problem.
Why do you want to treat spinal cord injury?
Yes, sir.
Why don't you treat back pain properly? Everyone is having cervical spondylitis. Everyone is having back pain. Why don't you learn how to treat back pain properly? Only if you treat back pain properly, I tell you within 1 month, 2 months, 3 months, there will be 50, 100 patients in your clinic. Everyone is having back pain.
Yes, sir.
Not maybe, it is truth.
Yes, sir. Yes, sir.
Because people have gone to sedentary lifestyle.
Right, sir.
They go to physiotherapist. We have 3 physiotherapists. They put electrotherapy. What will happen? Next day again patient come with you. Go again to my videos and see
Yes,
what
sir.
is speaking.
Yes, sir. That's what I'm asking. If we are confident in just practicing it, can we practice? That's what my question is.
If you are confident, And government has not given any problem in your state. See, problem will come when you have created a problem.
Problem, yes, sir.
And it will come only when you do not know the rules of the game.
Yes, sir.
And it will come anywhere. If you do not know how to drive when you drive a car, what will happen? आपको गाड़ी चलाना नहीं आता है, गाड़ी चलाएंगे क्या होगा? When for driving a car, you need a license or not?
Yes, sir.
Do you need knowledge or not?
Yes, sir.
Then
Okay, sir. Thank you, sir.
I don't know, one MTech PhD is most willing to learn and is doing good job. Even Prakash Jain you see, they are not medicos. Mickey you see, this is not a medico. Mukesh Rawat is just learning 3 months back, he started learning acupuncture from me. How well they are doing? Ask Mukesh Rawat. Mukesh ji, are you there?
Yes, sir.
You tell your experience.
Sir, with a second. Myself, Mukesh Rawat. So I'm audible.
Yeah, you're audible.
Yes.
Yeah. I learned with sir in January classroom workshop. And from that days, I am treating the case of myelomalacia, quadriplegia cases, and they are recovering very well. Previously, I was referred or denied for treatment, but now I am treating with this only this NIBS technique and dry needle, and they are recovering very well. And my confidence is so good. I go back again with my two friends, and they also work with cervical myelopathy, myelomalacia, and all are getting. Only I am not getting result. My all friends are getting result, and we are too happy to learn these things. Basically, we have to know our limitations, which case we have to be treat and which case we have to be not treat. We should be know this only by knowledge, and sir providing this knowledge in programs, diploma training programs and certificate training program, some paid program. All these are for knowledge, our knowledge. First, we have to get knowledge, know our limitations, what we should treat and what should we not treat, and which we have to be treat, how we have to be treat by our traditional knowledge, by Ayurveda, allopath, homeopath, acupuncture, either NIBS. What is applicable? We have to be combine all that things in our limits. Sir is only doing these things. Sir developed many techniques for revival of the patient. We mostly focus on NIBS, and we get a lot of results. Or so I told sir. Nowadays, I treated previously LIB, PIVD, cervical spondylitis, but today in my OPD, 6 myelomalacia patient is continuing in treatment, and they are
What is
getting
myelomalacia? Tell them.
cord myelomalacia, sir, cord compression, cervical cord compression, and become the myelitic. Means they are changing their
See,
a
the
type of
thinning of the
swelling.
cord. It is called thinning of the cord.
Yes, sir. And but due to that, patient going to be paraplegic.
What? The condition is quadriplegia.
Quadriplegic. Patient going to be one of my patient is admitted here, and she was unable to hold the cup of tea, and she was unable to move without support. In 14 days, I think so, 13 days, sir. She is able to walk independently and able to hold a glass of water. And she's matlab, too happy. And
But this cannot be treated by neurosurgery.
no, not never it treated. One of my patient was treated with neurosurgeon, sir, also. And neurosurgeon told him, I can stop the progress of disease, but can't revert the symptoms. And he again sent to me. कि go for that place and take your treatment continue.
Now you see, January to June. This is the confidence. Upgrading knowledge is nothing wrong. Rather, helping each other, encouraging each other will only help you to understand the subject more. In the whole WhatsApp group, I have seen what you have written today. So many people have been able to recover. Why not you? If you don't have the confidence, don't touch the patient. Why to study? Go and study any other subject. Do MBA, do BBA. Confidence comes from your knowledge. And knowledge has to be continuously upgraded from YouTube, from Facebook, from videos. Time to time, we'll get a lot of cases to know how I am treating them by attending workshops. Then only you will learn. We'll have interactive classes tomorrow. Okay? You must know how to study so that when you meet any allopathic doctor or anyone, you can explain what you have done so that tomorrow he can refer the patients to you. You can pinpoint out, so this was the condition, this is the symptom, now here is the patient, you can ask him. Right?
Yes, sir.
TCM is very difficult. Tomorrow TCM will be very difficult to be treated in India. Why? Why? How common people will understand liver deficiency, kidney deficiency, indeficiency. They will show you an X-ray. If you are not able to understand the X-ray, how will you treat a patient? So understanding the pathology of the disease and treating the disease is the goal of life. And I'm sure many people can do it nicely. Only if you don't have confidence, we can't. First thing is knowledge. If your knowledge is not upgraded, it's very difficult for you to treat any patient. Step by step, you will understand different types of disease classification, and under each classification, you have to identify how a patient is behaving, what is Alzheimer's, grade 1, grade 2, grade 3, grade 4, grade 4 Parkinson's, what are the stages, how to revive the resting tremor, to what extent you can revive. All this you have to understand. समझना पड़ेगा. खाली मेडिसिन लिखने से कुछ नहीं होगा, कुछ हुआ ही नहीं है, इतने सारे प्रिस्क्रिप्शन भरते पड़े, क्या होगा? We can make you the condition understand, but when the treatment comes, it is very late. तो समझना होगा आपको. You have to understand. Then only you can go ahead. Just taking a car and driving will make accident. Spend some time in learning, 1 hour a day. Encourage everything, write positive things in the group. I've seen one American girl who said, I know nothing. Now she is speaking so nicely about all the Robinson's show and all everything. She hasn't any, you might all have seen any in the group as a coordinator. She knew nothing. She knew zero when she came to me. Now see what is the level of knowledge she has. You see, in 5 months, the level of knowledge of Mukesh Rawat. They studied, they did again. The knowledge what you have earned now, no one can take it away from you. High number of patients are there who needs recovery. It's all up to you how much you study. Thank you so much. Good night.
Thank you so much, sir.
Thank you.
Good night,
So,
Sastri ji.
Dr. Sastri ji.
Thank you, sir.
Thank you, sir.
Recording in the class. Prakash
Thank
ji,
you, sir.
class में recording.
Thank you, sir.
सर क्या बोल रहे हैं?
क्लास में रिकॉर्डिंग दे दीजिएगा डिप्लोमा ट्रेनिंग.
स्टॉप कर दो.
डिप्लोमा ट्रेनिंग की रिकॉर्डिंग बाकी ग्रुप में दे दीजिएगा.
ठीक है, क्या मैं स्टॉप करूं?
हाँ, स्टॉप कीजिए.
Thank you, sir.
Thank you,
Prakash.